Douching, the practice of washing or cleaning out the inside of the vagina with water or other mixtures of fluids, has been around for centuries. It's often marketed and believed to be a way to maintain cleanliness, eliminate odors, or prevent infections. However, medical experts overwhelmingly agree. Douching is not only unnecessary, but it can also be harmful to your health. The vagina is a self-cleaning organ. It maintains its own healthy balance of bacteria and pH, which is crucial for keeping infections at bay. When you douche, you disrupt this delicate balance. The healthy bacteria, known as lactobacilli, help prevent overgrowth of harmful organisms. Douching can wash away these good bacteria, making it easier for infections to take hold. One of the most common complications associated with douching is bacterial vaginosis, a condition where the natural balance of bacteria in the vagina is thrown off. Women who douche regularly are more likely to develop this condition, which can cause unpleasant symptoms like unusual discharge, odor, and itching. Bacterial vaginosis itself can lead to more serious health problems if left untreated, including an increased risk of sexually transmitted infections and complications during pregnancy. Another risk linked to douching is pelvic inflammatory disease, or PID. PID is an infection of the reproductive organs that can cause chronic pain, infertility, and even increase the risk of ectopic pregnancy. Studies have shown that women who douche are at a higher risk for PID compared to women who do not. The act of douching can push bacteria up into the uterus, fallopian tubes, and ovaries, spreading infections that might otherwise remain in the lower genital tract. Yeast infections are also more common in women who douche. Just as with bacterial vaginosis, disrupting the natural flora of the vagina can give yeast an opportunity to grow unchecked. This can result in itching, burning, and discomfort. Ironically, some of the very symptoms that might lead someone to douche in the first place. Douching does not prevent sexually transmitted infections, nor does it prevent pregnancy. In fact, by irritating the vaginal tissues and altering the natural environment, douching can actually increase your risk of contracting infections like chlamydia, gonorrhea, and HIV. The irritation can create small tears or inflammation in the vaginal lining, making it easier for viruses and bacteria to enter your body. When it comes to pregnancy, some women believe that douching after intercourse can prevent conception. This is a myth. Sperm can reach the uterus within minutes, long before douching would have any potential effect. Moreover, douching after sex may actually increase the risk of infections that can affect fertility. There are also concerns about the ingredients in commercial douching products. Many contain fragrances, antiseptics, and other chemicals that can irritate the sensitive tissues of the vagina and vulva. Repeated exposure to these substances can cause allergic reactions, inflammation, and even long-term changes to the vaginal environment. Despite all these risks, douching remains a common practice in some communities, often passed down through generations or promoted by misleading advertising. The idea that vaginas need to be cleaned or deodorized with special products is a misconception. Vaginal odor is normal, and variations in scent are usually a sign of changes in diet, hormone levels, or the menstrual cycle, not a sign of poor hygiene. The best way to care for your vagina is simple. Let it take care of itself. Gently washing the external genital area with warm water is all that's needed. Avoid using soaps, sprays, or powders inside the vagina. If you notice persistent or unusual odors, discharge, itching, or irritation, it's important to consult a healthcare provider rather than trying to self-treat with douching or over-the-counter products. For those who are particularly concerned about personal hygiene, remember that healthy vaginal discharge is actually a sign that your body is functioning properly. Discharge helps to clean and protect the vagina naturally. If you experience changes in color, consistency, or smell that seem abnormal, this could be a sign of an infection or other medical issue that requires professional attention. Cultural and social pressures can make it difficult to ignore the marketing messages that tell you your body needs extra cleansing. But armed with accurate information, you can make informed choices about your health. Healthcare professionals, including gynecologists and sexual health experts, consistently advise against douching for all the reasons mentioned above. In summary, douching is not safe. It offers no proven health benefits while posing significant risks to your reproductive and overall health. The vagina is designed to maintain its own balance and cleanliness. Interfering with this natural process can lead to infections, fertility problems, and increased risk of sexually transmitted diseases. If you have concerns about hygiene, odor, or discharge, the safest and most effective step is to seek advice from a qualified healthcare provider, rather than reaching for a douche. Remember, your body is amazing at protecting itself when left alone. Trust its natural processes, treat it gently, and don't fall for myths that could put your health at risk. The best care is often the simplest. Let your vagina do what it's meant to do. If something doesn't seem right, don't hesitate to talk to a healthcare professional. Your health and well-being are worth it.